Hello everybody, this is Dr. Fawaz Al-Mutairi. I'm the president of Gulf Interventional Society, and this is part of our conference, and it's my pleasure to have my dear friend Dr. Mohammed Al-Rushaydan. He's the director of the Cardiac Center in King Fahad Medical City. And today, Dr. Mohammed, we have a great session talking about the left main, and it's as always, it's a debate and challenging between interventional cardiology and the cardiac surgeon. You did a great presentation. Actually, you convinced a lot of people that the CABG is still a standard of therapy in left main, although there is a lot of discussion and should take it case by case. So kindly just talk to us about the session and what you think about it in this morning.
Thank you, Dr. Fawaz. It's a pleasure to be today here in Gulf Interventional Society. I think this meeting set the standard very high and set the stage high for everybody. I think left main is still, it's going to be always a debatable talk. And the good thing about it that we have now a mutual understanding of who is the patient who's going to benefit from the standard of care treatment, which is CABG. And again, I would say the other standard of care, which is BCI. I believe that today the session tackled this very nicely. Dr. Hussein Al-Amri, who was my co-chair on the session, and he presented nicely about what is the current data on BCI and who's the patient who would benefit. And on the other hand, I presented who's the patient who will benefit from CABG. But I agree with you. At the end of the day, it is a heart team discussion.
Right.
It's patient-centered approach. Will choose the best treatment according to what the patient needs.
Exactly, and I think you used to have, when it comes interventional cardiology and the cardiac surgeon, everybody going to push for his own specialty. This morning, what we saw that both of you is talking about combining and heart team discussion together, and it's what's better for the patient. And some left main can go for BCI safely if we do BCI appropriately in a cath lab using imaging and end up with the will-opposed stent. And some of the cases is going to be difficult for BCI with outcome in the future is not the best, and it's going to come to you as a surgeon. This new mentality of the new era combination between the cardiac surgeon and intervention, how we see it more than left main? I think in the structural also we have the same mentality.
I believe now cardiac surgery and cardiology have the best relationship ever, because I think the way I see this, I think surgery and cardiology, they are complementary for each other.
Exactly.
For example, we could have a patient who needs to go for a very complex CABG, but the patient is heavily comorbid, bedridden, and he cannot tolerate surgery.
Exactly.
Then you're going to take this patient courageously and do a very complex BCI, and we know that might be the outcome of BCI is suboptimal for this patient, but we tailored a treatment according to what the patient needs. Same goes for, as you said, Dr. Fawaz, the structural heart disease, which is now we have multiple therapies. And the good thing, we work teams. Like TAVI can be done as a primary operator, cardiologist, secondary operator, surgeon. They can share decision. The same goes for mitral clip, tendine valve, and goes on. I think I totally agree with you. Heart team discussion is the gold standard now, and this will also not only improve the outcome of the patient, but also it will improve overall community and overall communication between the two subspecialty.
Great, and we agreed this morning that heart team discussion is the way to go, and involving the patient in the management. Can I say something?
So look, now if you look, before we never heard about patient-centered care, patient-shared decision. Now it's part of the guidelines and it's class 1. So I agree with you. Patient should be the gut go. Like he's the one who should decide what he wants to do after having what you call informed consent about what's good, what's bad, and what will happen to you if you choose any route.
Great, and I cannot thank you enough, Dr. Mohammed. I think you did a great job in the session this morning. And this is a Gulf Interventional Society always bring people to have a great educational activity and educational discussion under the umbrella of GIS. Thank you very much.